the way people pay for health care. It's an insurance that you can afford the premiums and you can afford to actually use. The first thing I need to tell you is it's offered through the Small Business Association. The Small Business Association was founded in 1984 as a nonprofit organization with the goal of helping its members, small business owners, reduce some of their overhead. They offer benefits such as discounts on office equipment leasing, discounts on car rental, the ability to buy cars and vehicles at wholesale, travel assistance, travel club, discounts on vitamins, RX, supplemental things, access to medical care over the phone, doctors and nurses, a $5,000 accident injury policy, and much more. So, what's the problem with health insurance? Well, it's expensive. In fact, if you pay for your own health insurance, you probably have at least a $5,000 deductible. Why so high? So you can afford the premiums. In fact, $5,000 is the most popular deductible sold today. The problem is most people never reach it. Underwriting can be difficult. Pre-existing conditions can go back 5 years or more. Some conditions can be excluded for life. So people don't really have insurance they can use, they just have a premium instead. So what's the solution? We call it health insurance for people who understand insurance. It's affordable, both to have and to use. It has relaxed underwriting, which means you may be somebody who can't get insurance somewhere else, and you might be able to get it through us. There's no deductible for your outpatient visits. In fact, most office visits will have no copay. There is a $0 or $500 deductible for the hospital, and as I mentioned, you get an additional $5,000 accident ER coverage. And there's many more benefits as well, as we'll go through. So how are we able to do this? Well, first of all, the Small Business Association, we designed the plan, and then we went out to find an insurance company who would underwrite it. So it's offered by United Teachers Associates Insurance Company. It is a company that is reinsured and administered by Cigna. It's designed to meet the needs of 95% of the population. It's a new kind of plan which is called a specified benefit plan, and it utilizes one of the largest networks in the country. The first thing is when you go to the doctor, you simply show a card. You have no copay. You'll have a copay possibly later, but we'll talk about that more. The company's going to discount the bill. Then they're going to pay their specified amount toward that care. Because they know exactly what their costs are going to be, they're able to keep their premiums low. Okay, let's talk about how this plan pays. There are only two options, A and B. When you go into a hospital or you go to an outpatient surgical center, option A is going to pay $1,000 per day. Option B is going to pay $2,500 a day. Both plans will pay an additional $500 when you're in the ICU. On Plan A, your admitting doctor receives $50 a day. On Plan B, $75 a day. That's essentially the difference between the two plans because everything else now is identical on each plan. For example, if you have surgery, it will pay the surgeon 150% of the Medicare eligible charge. This will cover their contracted rate. It also pays the 20% of the surgeon's fee for an assistant surgeon, and it pays the 20% of the surgeon's fee for the anesthesiologist. When you go to the doctor, which is what normally happens with most people, they don't have surgery, you go to the doctor, it's going to pay on either plan $75 toward that office visit. We also cover wellness. You get an extra $35 towards that. You get an additional $125 in the ER for option A and another $250 for option B. Pap smears are covered, mammograms are covered, X-rays, MRIs, PET scans, CT scans. We'll even pay $150 a day for up to 30 days for home health while you're recovering from a surgery. Let's look and see how this would actually work. Let's say you had a routine physical. On a major medical plan, if you went to the doctor, he's probably going to charge $165 if you don't have insurance. Reprice, that goes down to about $110. With a major medical plan, you've probably got a copay of $40. You're going to have lab work, which typically runs about $235 to $240. It would be repriced down to about $33. Your copay would be $25. So the total repriced bill is $143. You would pay $65 of that, and you'd be done. On our hybrid plan, say the costs are exactly the same, $165 repriced to $110. The insurance company is going to pay $75 toward that visit. When it comes to the lab work, $237 repriced down to $33. This is where your wellness comes in. Company's going to pay $35. And you say, well, why would it pay $35 when the bill's $33? Because this is a specified benefit plan. What that means is it is going to pay whatever the amount allowable is, not up to a certain amount. So, in this example again, you've got a $143 repriced bill. The insurance actually pays $110. You end up paying the difference, which is about $33. That's roughly half of what you would pay in your typical major medical plan. Or what happens if you get sick? Let's say that you got the flu. Maybe you didn't go for quite a while. You might even have walking pneumonia. You go to the doctor on your major medical. His regular price is $130, repriced down to $65. That's a very accurate fee. That's what my doctor's reprice bill is. If I was on a major medical, it'd cost me about a $40 copay. Let's say I had a couple of x-rays because he was concerned I might have pneumonia. List price at $180, repriced to $110. I'd probably have a $25 copay on that. So the total reprice bill is $175, and it cost me $65 on my major medical plan. On the hybrid, same cost, same repricing, the insurance company is going to pay $75 for the doctor visit, even though it's repriced to $65. Again, it's because it's a specified benefit. We're going to pay all the amount. On the x-rays, repriced down to $110, the insurance company is going to actually pay $100. So the repriced bill is $175. Well, the insurance company actually paid $175. You walked away with no copay. Can you see how using this plan is probably less expensive than what you have going right now with your major medical? Let's look at a 3-day stay in the hospital. Although most people don't go in the hospital, especially small business owners, because you can't afford to be away from your business, let's say that, I don't know, your gallbladder burst, and now you've got a 3-day stay. List price for people who don't have insurance, as you look down the various costs, would probably come close to about $31,000 for that hospital stay. The repriced or contracted rate brings it down to $11,850. If you have a typical major medical with a $5,000 deductible, you're going to pay the first $5,000 of that $11,850, and then you're going to pay 20% of the remainder up to the top of the repriced bill, which means your total out-of-pocket in this example would be about $6,500. That's on your major medical. Let's look at how you would be covered on the hybrid. On option A, which pays $1,000 a day in the hospital, they would pay $3,000 first of all because it's a 3-day stay. They're going to pay $150 to the doctor. They're going to pay the surgeon's rate, and they're going to pay the assistant surgeon and the anesthesiologist, which means the insurance company ends up paying $10,150. There's no deductible, there's no 80-20. You just pay the difference between what the insurance company paid and the contracted rate, which in this case is just under $1,700. That's a heck of a lot cheaper than $6,500. Let's look at how option B would pay. Remember, option B pays $2,500 a day in the hospital. So A 3-day stay would mean that the company would pay $7,500. It's going to pay $225 to the admitting physician, and it's going to pay the surgeon, the assistant surgeon, and the anesthesiologist, just like it would in A. So the total the insurance company pays is actually $14,725. And you're saying, well, that's more than what the bill was. Yes, it was, but it's a specified benefit. On this plan, you have a $500 deductible in the hospital. So after the insurance company pays the bill and deducts your deductible of $500, you will get a check for the remainder. In this case, $2,380. Almost $2,400 you would get back. And people say, I have never heard of an insurance company paying back money. This one does. Now, while most people don't buy insurance so they can get paid if they get sick, some people do, because they say, look, I'm going to need some extra money. I've been off work. I've lost some business. This will help me keep my bills paid. So that makes sense. You can have it either way you want. Now, I said earlier that most people don't go in the hospital. In fact, 3 out of 4 procedures are now done outpatient. On the left, I've got the most popular outpatient procedures done in the United States. And you can see them down the left: gallbladder, colonoscopies, arthroscopic knee surgery, and so on. On the next to it, the next column over, under the charge. Now, this is based on the healthcarebluebook.com, which looks at the most often charged bill for these different services. Okay? So that's the charge. Under option A, it shows you what we would pay toward that. In the next column, it says you owe. This would be the difference between what the average bill is and what option A would pay. So, for example, if you had outpatient gallbladder surgery, it's going to cost you about $575. Arthroscopic knee surgery, about $425. As you look down the list, nothing's over $800. Now, it's true, it's not free, but it's affordable. If you had a $5,000 major medical plan, you would pay 100% of those charges unless you had reached your $5,000 deductible. So a small copay is better than that. If we look at option B, you're going to see that we will pay more than the average bill, all the way down. So what does that mean? After the bill is paid, you're going to receive a refund. That's what those numbers are in green. Again, we're going to cover you as well as you're covered now for almost everything that can happen. It's going to cost you less to have this plan. Typically, we're in the range of about 30 to 50% less than a major medical, and it's more affordable to use. So if you have questions or would like to enroll, you can call me at 941-840-1889, or you can reach me at